Welcome back to the Morning Blend. This is Dana Halverson. She used the medically supervised HCG diet to lose weight. She is here along with Dr. Deborah Manjoney and Amelia Tollefson with the Transform Diet and Wellness Center to tell us her story and more. Nice to have you ladies here.
Thank you.
Thank you so much. Congratulations to you.
Thank you.
You lost, you told me during the commercial break, 54 pounds.
Correct.
That's a lot. So you did you do just one round of HCG?
2 rounds.
You did two. So you had to take a little break in between?
Yes, 8 weeks in between.
Okay, so over how much time did you lose these 54 pounds?
7 months.
Only 7 months. How do you
But
feel?
you did it over the holiday.
I started right before Thanksgiving.
No way. And so you went through you went through Thanksgiving and then Christmas.
And New Year's.
How do you feel? How's it changed your life?
Great. Just have more self-confidence.
I bet you do. How does the HCG diet work?
Well, Amelia talks to everybody about this diet, but the HCG diet works by helping to rev up your metabolism so that when you're eating a very low-calorie diet, you can do it safely and lose fat, preferentially to muscle. Because when we're losing weight, if we're really doing an extreme diet with very, very low calorie, which this is an extreme diet, you're going to lose your muscle mass, you're going to lose fat, but more muscle than fat. With the HCG, you're preserving the muscle while you're losing preferentially fat. And it's only the abnormal fat you're losing. You're not losing any fat you need around your organs. It is fat that frequently is in the places you don't want it anyway. And so you
Like
kind
the
of lose
middle?
that first, like the middle. You
Yeah.
kind of sculpt. Did you find that, Dana? Did you find that you lost weight where you wanted to lose weight?
More
Yes.
in the hips than I normally.
Yeah, because
Whatever
most people with dieting lose weight kind of where they don't want to lose it, where they don't necessarily need to lose it. I want to look at some pictures now because we have a couple different shots. One of them is kind of shows this before and after. So this is a front view, Dana, of you before, and then you can see an incredible transformation. We also have views of you from the side and the back because we don't want to miss any angle here. Yeah, everybody wants to have the picture taken from the back. But I mean, I think this is incredible. And Amelia, do you find that her story is actually typical, that a lot of people lose this much weight and in exactly the places where she lost it?
I would actually say Dana is probably an exceptional case, but yes, most people aren't losing 54 pounds because they don't always have 54 pounds to lose, but it's also they are losing weight. If you've ever seen someone who's had the flu for a week and they look haggard and they look sick and they look like they're starving because they haven't eaten anything, she looks fantastic. She's not unhealthy after finishing this diet.
Well, and let's talk about that too, because it's medically supervised. You say that it's safe, doctor. It's a very low calorie diet though, and the HCG is actually a hormone that is found in pregnancy,
That's right. That's right. But we're using a fraction of what is normally circulating the body during pregnancy. We're using a very tiny amount that's injected subcutaneously or taken as a wafer under the tongue, and the individuals do it themselves, and it's not difficult to do. And they go on a low-calorie diet. It's really no carbohydrates, limited fruits, just limited vegetables as well, certain ones that you're allowed to eat, and about 7 ounces of protein a day. So all in all, it's about 500 calories a day. It works best if people can kind of proportion out their meals ahead of time and know what they're going to do. But it really winds up to be a very healthy diet, and it helps to rev up your metabolism in a different way. It kind of resets your metabolism.
Well, unbelievable that people can lose a half pound up to a pound a day
and
in
men
many
can
cases.
lose actually more than that.
And men can lose even more than a pound a day. So we're taking a look actually at a man that also went on the HCG diet, and that's an incredible transformation from the beginning until the after picture that we see there. How much weight should women expect that they can lose? Because one round of HCG is how many weeks?
A round is anywhere from 25 to 75 days, depending on how much fat you can lose.
Okay, and we talked a little bit about how you can get paid to do this. So explain that part of it.
Well, we think it's important for people to not only lose weight, but to keep it off. And so we actually have a couple of things already set up. We have a support group that meets every 2 weeks or twice a month, and that helps. But once you've met your goal weight, if you can keep it off for 6 months, then there is a lottery drawing basically, and if your name is drawn, then you can get your whole investment back from what you paid for the diet and all the appointments you had, plus $100.
That's amazing.
So we
it
want to
pays
encourage people.
Yeah, I like that.
It pays to lose.
And what's the reason you started doing this at your practice?
I just think it's a great fit. I think that, we know that the American population is extremely overweight. We have been doing things to help people look and feel better, and I just thought it was a natural fit for us to then branch into a healthy kind of lifestyle with bioidentical hormone balancing for people who are a little bit out of balance, and also for the diet and weight loss.
It's unbelievable. So here's the information so that you can take part actually in a group session. The next group class starts June 26th, and it's just $700 for 5 appointments. Again, it's a medically supervised diet, and with that, the HCG is included. So there's no additional cost for the HCG, which you take daily. So the Transform Diet and Wellness Center is located in Pewaukee on Georgetown Drive. They're on Facebook and Twitter. You can find out more on their website. See if you're a good candidate for this. It's transformdietandwellness.com. And to schedule a consultation, you can call 262-264-5788. Great to have you again. Congratulations to you.